My name is Debbie. I've been a patient of Dr. Metz's for about 5 years. I've always had a lot of work to be done. My teeth have not always been in the best of shape. I've tried to keep up with it, but unfortunately, the work that's been done on different teeth here and there eventually was to my demise, because then it felt like all my teeth were different colors because they were done at different times in my life. And so the front of my teeth were awful. I had, to me, and when I looked in the mirror, I had 3 or 4 different colors going on. You know, there was one of my own and crowns that were at different times in my life. It's been very gradual that my teeth have become different colors, and then I needed to do some work on the sides of my front teeth. And Dr. Metz suggested that I maybe wanted to do more than just the side teeth so that they could all be one color. My sister used to be a dental hygienist, and so I went to her and I said, you know, it's kind of expensive to get all these done. Do you think, you know, he can do a nice enough job that I could just get, you know, the sides done and at least they'd be the same color? And my sister said, absolutely, do not, you know, go ahead and get them all done. Don't do 2 more, because you're just adding to the problem. It's just going to be, you know, in 5 years you'll turn around and wish you would have done it the way, you know. So yes, Dr. Metz and his staff just afforded me the opportunity and suggested it, and had me look at different patients that had had it done, and I sort of got excited and thought this may be a good opportunity for me to do it the right way. As far as the procedure and the pain level things, I really felt comfortable with that, because I've done enough dental work with Dr. Metz and his staff to know that I get very good care, and I have never been afraid. And I am very sensitive to pain. I mean, it would scare me if I thought, I wouldn't do it if I thought that if it was gonna be bad. The whole procedure took a lot less time than I thought it was going to. It was waiting for the teeth to get done. The temporaries were fine. In fact, they were sort of a prelude to being excited about getting the permanent teeth. I was, well, I cried. I mean, I was very taken by it and thinking, can't take this away from me. This is, and I mean, I've had a lot of dental work done, but this was the whole package. It looked nice. The teeth didn't look big. They weren't a color. They looked very natural for my age. I've had friends that have noticed, but they say, did you cut your hair? Did you do something different? I go, no, I got my teeth done. And then they'll go, totally, yes. But they, you know, and that's exactly the reaction I wanted. I didn't want somebody to walk up and say, oh my God, you got new teeth. You know, that would have bummed me out a little bit. Having my teeth done made me a lot more comfortable around people laughing and smiling, or having my picture taken with the family. Or I was always, you know, in the last few years, having noticed the discoloration and the change, I would try to stand to the side or in the back and keep my top lip down so that it wasn't so noticeable. Now, the beauty of it is I don't really even think about it. I'm the first one to jump in and say, hey, let's take pictures. And then it seems like a small thing, and now, after having been over a year, I don't really think about it anymore, and that's fun to think that I don't have to think about it, because I used to think about it all the time. So I would have done it sooner. Absolutely. You know, some of it is financial, and but then again, you know, I saved up money to get LASIK surgery on my eyes, and had I really thought of, I really hadn't really thought about it. Thought about doing them all. You know, that you don't know until somebody explains to you, you know, we can do this, and let you go home, think about it. You know, I mean, that's what Dr. Metz and the staff did is, you know, they presented it, and then they let you go home, and they don't it isn't a sales job. It's like, this is what we could do. Would and it gives you the opportunity to go, hey, yeah, I could totally fix this. I can make it look really nice so that when I look in the mirror, that's not what I'm looking at. I'm the one that's got to look in the mirror the most. And so, yes, I would. I had never really thought about doing it. And if you have that opportunity and you think, yeah, that'd be nice, you can figure out a way to get, somehow save up and get it done. It's expensive, but it's well worth it.